Hi there, my name is Steven. I'm from Cameroon. I work with the Integrated Youth Empowerment Center, which is a non-profit association. We have a project to mitigate malaria, which is caused by mosquito bites in our community. And specifically, we are talking about the Mukunda Road community in Limbe, which is in southwest Cameroon. We intend to implement this project to, mitigate mosquitoes in our community, which is a cause for malaria. If you look at statistics like WHO statistics for 2019, it says Cameroon, 30% of consultations in Cameroon hospitals were on malaria. In our local hospital, the statistics is more. So we want to implement this project because we have conducted its assessment and we have seen that a lot of illnesses in our community are related to malaria. So this is a disease that is very common here and there is need for us to eradicate because it keeps killing a lot of people and majority of people don't have good health because of malaria. So we want to do something on local level by engaging in a project that will reduce the amount of mosquitoes in this community. What makes it worse in this community is that it's an area where garbage is dumped, municipal garbage is dumped, and in such an area, people shouldn't live by, but as a green space due to urbanization, the town is expanding to these areas and the people who live by are suffering from mosquito bites and as a result are contracting malaria and giving a high burden to the local hospital. So as a community organization which is non-profit, we want to engage in a project of cleaning up the environment, keeping it very clean, removing use and grass, and maybe making all the dishes dry and clean along the street. And we will also distribute mosquito bed nets to households, about 50 households. Then we intend to also do something that will reduce the amount of mosquitoes by maybe like planting flowers around, flowers that will attract dragonflies. And these dragonflies eat up these mosquitoes. We always keep them at bay. So when we have flowers around, you can imagine the beauty we shall have in the area because it will attract other insects like butterfly that will be doing the pollination and the area will look very beautiful and there will be no more mosquitoes. And if there are no more mosquitoes, we will not have malaria. So this is just the simple ways we want to do as a community, as volunteers, and try to see how we can help our medical services reduce the burden of malaria. So to do this, we have set up a budget, not so much, and it came up to $1,400, but we have raised $400, and what we need now is just $1,000. And we believe that in 3 months, we will be at the end of this project where we can make our reports and evaluate the trend, the statistics of people contracting malaria from our community, which we hope that it will reduce. And in that way, we shall help our health services to engage in other sicknesses like maybe COVID-19. Talking about COVID-19, how are we going to work during this period of COVID-19? We intend to engage in this community work by respecting social distancing and also absolutely working with our mask. That is just the way we are going to do and we hope we can prevent COVID-19 also from spreading among us. So we are here in Limbe once more and we hope you understand our project and we are willing to submit hard copies or soft copies of the project to our donors. I want to thank you very much. Have a nice day.